A lot of people in the world have difficulty accessing sickle cell treatments, so I think it makes sense to pay attention to something as abundant as oxygen in the air that we breathe. Now, obviously oxygen's already used in hospitals when sickle cell crisis affects the lungs, but what's fairly new is people trying it at home overnight to prevent crisis before they start. And a few of you have asked me about it, and some have said that it's helping, so let's break it down. So firstly, a little bit of theory. In sickle cell, problems start when red blood cells give up their oxygen in the tissues. Now, I want you to imagine that as soon as they drop off their oxygen, a countdown timer starts, and they've got a few seconds to escape the narrow capillary blood vessels and get back to the lungs to receive more oxygen before they start to sickle, change shape, and get stuck. If they're still in the capillaries when the change of shape happens, then they get stuck, and that's when the crisis pain will start. Now, here's where oxygen therapy actually comes in. When we sleep, our oxygen levels drop slightly because we naturally breathe more shallowly. And if you snore or have an airway obstruction of some sort, then the oxygen levels drop even further. So with there being less oxygen in the blood, the countdown timer for those red blood cells runs out even faster. So the idea behind oxygen therapy is to keep oxygen levels steady so they don't drop all night, and that gives the red blood cells more time to escape the capillary circulation before they sickle. So in theory, this should lead to much fewer crises because there's less red blood cells getting stuck in the capillary circulation, because the oxygen therapy is essentially buying them time to get out of the tiny blood vessels before they change shape and get stuck. So long-term oxygen use isn't a standard treatment for sickle cell yet, but it's an interesting approach. Ideally, it's only used under specialist supervision for people who have frequent nighttime sickle cell crisis or early morning pain. I think also if you have normal oxygen levels overnight and use oxygen therapy, then it's probably not going to make much difference. So I hope that explanation makes sense. Let me know your thoughts and experiences with using home oxygen for preventing sickle cell crisis.